What is HIPAA? For both healthcare professionals and patients, HIPAA ensures the protection and confidentiality of health information. HIPAA regulations ensure confidentiality in doctor's visits, protect personal data in health apps, and govern the reporting of medical data breaches. In other words, HIPAA defines healthcare privacy and security. HIPAA, or the Health Insurance Portability and Accountability Act, was signed into law in 1996. It modernized the flow of healthcare information and explained how personally identifiable information should be protected. HIPAA applies to two main groups. First, covered entities. Now, this includes healthcare providers like doctors, therapists, clinics, or hospitals. It also includes health plans, from health insurance companies to HMOs and healthcare clearinghouses that process health information. Second, business associates. Business associates are individuals or companies that provide services to a covered entity that involve handling or transmitting protected health information. Think of an IT provider hosting electronic medical records or a third-party administrator who manages health plan claims. One example is Gmail. Google might be considered a business associate if a doctor uses Gmail to communicate with patients. Business associates must sign agreements known as business associate agreements. This contractually assures they will maintain the confidentiality and security of protected health information. HIPAA is not actually one big rule, but a collection of distinct parts, each addressing a specific aspect of health information. So let's break them down. The privacy rule. Think of the privacy rule as the guardian of your medical records and personal health details. It sets the standard for who can access this information and under what circumstances. For example, patients have the right to view their own health records and even request corrections. But on the flip side, there are strict limits ensuring only those genuinely involved in their care can access those records. Next up, the security rule. Now, while the privacy rule covers all health information, the security rule is the digital protector, focusing on electronic health data. It's all about keeping this data safe, whether that's through training programs for staff, physical measures like secure storage, or tech solutions like encryption. The breach notification rule. Mistakes happen, and sometimes data gets exposed. This rule is all about transparency. If there's a breach, the affected individuals must be informed promptly. If it's a significant breach, even the media and certain government bodies get a heads up. The Department of Health and Human Services Office of Civil Rights maintains a list of breaches called the Wall of Shame, and no one wants to end up on there. The enforcement rule. Now, this is where consequences come into play. Depending on the violation's nature and severity, penalties can range from fines to, in extreme cases, even jail time. Together, these components form the backbone of HIPAA, ensuring that health information remains private and secure. So why does HIPAA matter so much? First, it's about trust. When patients share their health information, they're placing immense trust in healthcare professionals and systems. HIPAA ensures that this trust is not misplaced by setting standards for how this sensitive information is handled. Secondly, it's about rights. Patients have the right to their own health information, to know who's accessing it, and to ensure its accuracy. HIPAA empowers individuals by giving them control over their own data. The consequences, though, of not adhering to HIPAA can be severe. Beyond legal penalties, breaches can damage reputations, erode trust, and even impact patient care. In essence, HIPAA is the glue that binds the healthcare system's commitment to preserving the security of patient information. The digital revolution has transformed almost every aspect of our lives, and healthcare is no exception. In the past, health records were physical papers locked away in cabinets. But today, digital files are stored in the cloud, accessible from anywhere in the world. Now, this convenience comes with its challenges. Cyber attacks, data breaches, and unauthorized access are serious threats. HIPAA has evolved alongside these changes. It ensures that even as the health information goes digital, the same standards of privacy and security apply. These standards require healthcare organizations to use cybersecurity measures like HIPAA-compliant email, multi-factor authentication, and access controls. So although the tools and platforms may change, HIPAA's commitment to protecting health information remains constant.